Hello everyone. During today's lecture, I will explain about a very common health condition, which is the cellulitis. The reason I choose this topic because cellulitis is very common among elderly people, especially for those people with very fragile skin. So what is cellulitis? Cellulitis is a skin infection caused by two types of bacteria. Now these bacteria include Streptococcus and Staphylococcus. So it's caused by bacterial infection. Okay. Now what bacteria? Now we said two bacteria. One is called the Streptococcus. Another one is called Staphylococcus. Now these two bacteria, they frequently attack human body, especially the skin. Now Streptococcus can normally also stays inside your mouth and airway inside your respiratory system and causing the respiratory infection as well. And sometimes Staphylococcus can be very serious because this type of bacteria have all different strains, and some strains of this bacteria actually become resistant to certain types of antibiotics. So some antibiotics cannot kill this bacteria. That's why when people have cellulitis, if we don't treat it on time, these bacteria could further travel through the skin and into the bloodstream and cause serious infection, especially for older people. So it's really important that as a nurse, when we look after elderly patients, we need to pay extra caution to their skin condition. Now, so we know that it's a skin condition, but cellulitis actually do not cause infection everywhere on the body, on the skin. It mostly only attacks the lower legs. Normally the infection happens on the lower legs. Now, when there is an infection to the lower legs, so what are the signs and symptoms? Now we can talk about the signs and symptoms. So the first sign is like the leg could become really red. So the skin become red. And also the skin redness. And also the temperature on the skin will increase. So increase of temperature. And also both legs will look very swollen. The skin area looks really swollen, especially on the lower legs. Like we said, it attacks mostly on the legs. Now, so these are common signs and symptoms. So what causes symptoms? So we know that, and actually we know that it's a skin infection. Why this bacteria can travel inside your skin? So because they need to have a chance to go into the skin. So what can make you have more chance to get this bacteria? So if your skin has a skin tear, if there's a skin tear, or if something tears your skin there and make a broken part on the skin. Now, if your skin has like a skin cut or skin tear, or like something penetrating in your skin and making your skin broken. So, and then the bacteria will get easier to travel through that broken area and then into your body and cause the whole skin gets infected. So that's why it is really important to protect skin and to maintain the skin integrity. And we know that like elderly people, they normally have very dry skin. So when the skin becomes really dry, it becomes easier to break. Now, skin is a natural barrier to help our body to prevent the bacteria. So in the whole environment, there are a lot of bacteria exist in the external environment, but they don't normally travel into your body because you have skin, and skin act like a barrier to prevent bacteria from traveling into your skin. Now, but if the skin gets broken, the bacteria will be much easier to go inside. And for older people, like we said, older people have really weak skin. Why is that? Now think about the skin structure. The top two layers of the skin include epidermis and then dermis, and under the dermis there is subcutaneous tissue. Subcutaneous tissue is like the fat layer inside, underneath the top layer of skin, to maintain a good insulation, to preserve the temperature and to hold heat. So but when people get older, this subcutaneous tissue will reduce, so patients will lose the fat. So again, the top two layers are epidermis, dermis, and then subcutaneous tissue. But when people get older, the subcutaneous tissue will lose fat, making the skin become really thin. So when the skin becomes thin and cannot preserve the heat, patient will always feel cold, cannot retain temperature, and skin easy to break because it's become very thin, and also easy to lose the heat. Also, there's another component inside your skin which is called the collagen. Collagen helps the skin to maintain a good hydration, helps to moisturize the skin, and also connect the skin tissues tightly together, so make the skin look tense. So now when people get older, the collagen level also reduces, so the skin will become easily to lose water and also become loose. The skin structure also will reduce. The skin cannot maintain a tight structure because of the loss of the collagen. So that's why older people have higher chance to get a skin tear or broken skin, and then the bacteria will be easily travels in and cause cellulitis. Now, when the bacteria actually attack that broken skin, and then they will travel inside, and then when your body's immunity start to realize there is a bacterial infection on that certain area, now the immunity will start to work and fight against that infection. So your broken area, now the wound area, where bacteria attack, and that area will also, the destroyed tissue will also release some chemicals. These chemicals will make your blood vessel down that area become dilated. Now these chemicals include important one called the histamine. So histamine actually can make your blood vessel in that area, in that broken area, become dilated. When the blood vessel become dilated, we call it vasodilation, and then the fluid is like the plasma inside the blood will leaks out through the blood vessel. So when it leaks out, the leg will look quite swollen. And also because your immunity actually start to aware about this infection, so the immunity going to send more like the white blood cells. We call it neutrophils. So send these white blood cells down to that broken area to try to fight against the bacteria. Okay, so this is like we call it inflammatory response. Now, the white blood cells and the damaged tissue will release a lot of different chemicals, and also will release the inflammatory mediators. Now, these inflammatory mediators will help to promote wound healing and to kill the bacteria. So during this whole inflammatory process, now the skin will increase the temperature. So when you touch the that area, now you will feel really hot. The skin becomes really hot. The temperature will increase, and also the skin will look really red. Because, like I said, Now the blood vessel dilate and then attract more white blood cells to travel down that area, and because more blood flow to that area, so the skin will look more red. So that's why people with cellulitis will have all these symptoms. Now these symptoms like redness, like increased temperature, like swollen leg, or triggered by the inflammatory response by our immunity. So now we know generally about cellulitis, then we have a look of how to treat this condition. If patients already have cellulitis, now what to do? So you need to start to give a medication called antibiotics. Now antibiotics needs to be ordered by doctor. So antibiotics needs to be immediately given to the patient to kill the bacteria. And as a nurse, what we can do? So we will need to treat the swollen leg and also the skin condition. Now, so how do we protect the skin? So we can, because like it is mostly happen in the lower legs. So to treat swollen, we will need to elevate the lower legs, to lift up the lower legs. So when we lift the lower legs, now the fluid down that area will flow back, will start to flow back to your heart. Flow back. So we'll start to drain the fluid back from the local area. So the fluid won't accumulate down in that area. So remember, always elevate the patient's leg, or you can put a pillow underneath the leg and elevate it. And also we need to monitor the patient's temperature, very frequently. And with the skin, because the skin becomes very fragile, so we need to maintain a good hygiene. Always clean the broken area with normal saline every day, and put on clean dressing to prevent the infection gets worse. So always clean the wound on a frequent basis with cleaning solution like normal saline, and regularly monitor temperature and elevate the legs, and monitor the skin condition. Now, so these are the common information about cellulitis. Like I said, because older people are very easy to have cellulitis, that's why we need to prevent the broken skin by constantly applying moisturizer on the skin, or like cream, to prevent dryness, and also assess the skin condition every day. If you find any little skin break, skin tear, you need to quickly notify doctor, or quickly like take action, or apply the dressing on the top to prevent further contamination of that skin tear. I really hope this small lecture could help you get more understanding. Thank you very much.